Okay, so I'm going to teach you how to use the cervical traction unit called the Deneroll. This is an extremely important part of your spinal corrective care, sometimes being worth 20 to 40 to 50% of your corrective care, so it's very important to use this. What this unit does is it's specifically designed and engineered that when you're lying on this unit, it helps to put the curve of your neck and mid-back in their optimal position. So then when you stay in that position, it's helping to re-stretch all the tightened ligaments and soft tissues in your body so that we can allow you to get your head back where it should be and the proper healthy curve in your neck. So the way that we start out by using this is we lie on the ground, and I'm going to be teaching you the placement for the lower neck. So if you're recommended a different position, you'll be informed by our office, and we'll show you a variation to this. But if you're receiving this video, you're going to be instructed to use the lower neck position. So you're going to place the unit straight on the ground behind you. And where you want the unit to be touching your neck, ideally, is we want to find the bump at the base of our neck. And we want to go just below that first bump that you feel. If you had a necklace on, it's pretty much just below where that necklace would hang at the back of your neck here. Okay, so we don't want it up in the curve in our neck. We want it just below that point where we all feel a bump where a necklace would hang right here. Okay, so what we want to do is we want to lie straight back onto the unit, and then what we want to do is we want to pull the unit down just so we get it down into the right position once we're lying. Okay, so we just very carefully lie straight backwards. The unit says shoulders this side on it, so you just make sure that that's facing you like this. And then you're going to lie straight backwards onto the unit, just like this. Let it get nice and comfortable. And then with your hand, you're just going to push it down, just so that you can feel it touching right at that first bump. So just right there. And then you're going to let your head just comfortably hang just over the top. Just like this, and you're going to lie just relaxed in that position. Now, if you get any types of symptoms into your legs or arms, you can bend your legs up and cross your arms. However, it's best if we can keep our body nice and straight and our legs and arms straight at our sides like this. And then we just want to stay in this position. We want to start with 1 minute and then progress by a minute each day. If it's really comfortable, you can progress a little faster. But if you get symptoms, make sure to let us know. Any types of numbness or tingling or sharp pains, we want to stop right away and let us know. And we want to progress ideally. You can get benefit from 3 to 5 minutes, but we want to get up to about a 15-minute range ideally per day to get the maximal benefit from the Deneroll. Now, if you're having trouble and it's too uncomfortable and it's too much of a stretch, what we can do is we can put a towel folded up or a very small pillow just behind our head so that when we bring our head back, our head won't hang as much. But we ideally don't want our head touching the floor. We want it to be slightly hanging so that we get a traction effect. But we can put this pillow here for the base of our head if it's a little bit too difficult. And if you find that your head is touching the ground and that your neck is nice and flexible, one thing that we can also do is we can take some sturdy, small, thin books, and we can just place that just underneath the unit just to raise it up a little bit higher so that then when you go back on your traction unit, it'll give you that little bit extra space in order to get the appropriate stretch. Okay, and then the most important part is the proper way to get off the traction unit. So you might have noticed in the demonstration that I just sat straight back up. What I recommend that you start with is to simply roll your body to the side. So make sure that when you're initially starting out that you don't just sit your body straight up, but that you roll to the side. So when you're lying on the unit for a minute or two and your head's back, the best way to get off the unit is to lift one of your legs up like this, and then just simply to roll your body gently to the side like this, and then just nice and slowly and carefully lift your body up to the side.